Howdy guys, Leki here from ProPhysio Plus. Today we're going to be talking about shoulder bursitis and why this is important to have a happy day. Please like the video, subscribe to the channel and share with your friends. Right, let's dive in. How do I get rid of shoulder bursitis? Now this is a very common question, and around your shoulder there's lots of muscles that provide the joint with stability. Imbalances around your rotator cuff muscles and other muscles around your shoulder girdle can commonly lead to inflammation of the fluid-filled sacs that accompany this space and help cushion the region. When the bursa becomes inflamed, this can become very painful. And this whole video and blog post is going to walk you through shoulder bursitis. Let's dive in. Okay, a common problem. What does shoulder bursitis feel like? Well, I'll give you three things to look for. Look for the location, look at your movement, and think about compression. In terms of location, it's most commonly found around this badge. We call it the deltoid badge of your shoulder. Think of the military. The badge is at the edge there. That's typically where shoulder bursitis refers to. In terms of movement, any elevation above your shoulder and particularly around the back. So elevating above your shoulder height and rotating, very unhappy for the shoulder. And in terms of compression, when you're lying on it at nighttime, can be very uncomfortable. Okay guys, shoulder bursitis. So if you put your X-ray goggles on and you're looking straight through my body, you can see this is my shoulder. I've got my collarbone at the front, my shoulder blade out the back, and my arm bone to the side. Now, what you don't see in this model is the muscles that help move the arm. But in terms of anatomy, you can see if the pen is a key muscle, okay, called supraspinatus, this muscle goes and slides under this space here called your subacromial space. This one muscle, in combination with the other rotator cuff muscles, as it contracts, it helps raise your arm like you're about to throw a tennis ball. Now, the problem here is, if your muscle is working very hard, then what happens is there could be a lot of friction in this space. Now, in this subacromial space, you can see the pen, there's a floor and a ceiling. So there's defined space. And for whatever reason, if that space starts to narrow, it creates impingement, okay? Now, that's a fancy way of saying things will get squashed. And what often gets squashed is the bursa. It's that fluid-filled sac that cushions between the bone and this very busy muscle. So that's a very important thing to note here, because if you do develop that closing of the space, it can tell us where the problem is and what we can do to start to help you out. Now, one quick test that we can apply is called a full can raise. So having your arm dead straight out by your side, thumb turned outward, and you're just raising your arm up. If at any point there you're starting to describe pain or it's feeling blocked, it's a sign that there may be something going on in this subacromial space, okay? Shoulder bursitis, not a happy customer.
All right guys, so we've got a couple of questions that we've got from Google and also what we see in the clinic all the time. So first question, what are the main causes of shoulder bursitis, Leki?
I'll give you the four main ones that I come across. Number one would be muscle imbalances. And they may be from different ropes that attach in and around the shoulder and into your upper trunk. And if they're not pulling in unison, creates a lot of anger, can create shoulder bursitis. The second thing is control. So there's little muscles around the shoulder blade, and if these muscles aren't working so well, they've fallen asleep, then it can create, again, imbalances, and then it can manifest that shoulder bursitis pain. Number three is usually trauma. You can see it at sports, work accidents, car accidents. So if you have a blunt trauma, then that can create shoulder bursitis. And the fourth can sometimes be medical. So if you're, say, type 2 diabetic, or if you suffer from diabetes, if there's hormonal challenges, if you're a pregnant mum, and if there's other medical challenges in your health profile, that can also contribute to developing shoulder bursitis.
Awesome. So question number two, Leki, that we see all the time. What is the fastest way to heal shoulder bursitis?
I'll give you the main three that we tend to recommend in the physio clinic. Number one, we always recommend the natural causes. So going through a very objective testing, going through and understanding your story through a subjective assessment. And the first step in treating shoulder bursitis is identifying the cause and contributing factors. So it may mean temporarily pausing some of the things that you enjoy because you're overloading and overcooking the shoulder. That's really some great advice to follow. The second thing, after a period of time, maybe you need some additional help, so we can refer you to see your local professional, your local GP, and maybe you can get some medicinal help if it's warranted. And if it starts to get even angrier, you may need to be referred for more help, which may involve injections or seeing a specialist.
Awesome. So some really, really great tips from you for you guys there from Leki. So question number 3. What happens if I don't decide to do anything for bursitis or it's just untreated, Leki?
Yeah, so this isn't the ideal situation. If you continue on your own accord, patient education is particularly important in the early acute phase regarding activity, pathology, and avoiding aggravating activities such as reaching and lifting. The general guidelines to progress from this phase is to decrease your pain and your symptoms and improve your movement, reduce your painful movements, especially into the abduction, out to the side, and improve your function. Okay, so if you followed the conservative management plan and it's still not responding, then long-term causes of your shoulder bursitis pain may require injections or surgical intervention.
So guys, to avoid all that sort of nasty stuff happening, go and see a physio quickly and get your shoulder bursitis treated. Question number 4, another big one is, what can be mistaken for shoulder bursitis, Leki?
Okay, so there's a lot of structures that move and slide around your shoulder, so let's try and break that down. You can have a complicated event like blunt trauma, you had an accident playing sport, so you may mistake shoulder bursitis for something like a broken bone, it could be a ligament issue, AC joint issue, it could be referral from somewhere else, say neck-related referrals. So you've got to be mindful of those complex situations. Number 2, it could be weakness from other areas that refer to the shoulder. Typically, one of your rotator cuff muscles out the back can actually refer to the front of your shoulder, infraspinatus, so look out for that one. The load is also important because repetitive movements can tend to wear away at your shoulder, so you can develop a bony osteoarthritic changes, and that can kind of refer a pattern that's similar to shoulder bursitis. You can have bony spurs, so arthritis gets more angry and they become bony outgrowths, not ideal. And poor posture. So if you're not nice and tall and upright, instead you're hunched over and you're reducing that space in the shoulder, that can also contribute to shoulder bursitis.
So there you go, guys. Some really, really helpful tips and information about shoulder bursitis. It's a lot of things for you to digest and to take away from it. So, and as always, if any issues at all, come down and see us at ProPhysio Plus.
So there you have it. We've laid out how you can navigate your shoulder bursitis pain. So let us know how you went with it. Please like the video, subscribe to our channel, share with your friends, and we'll see you soon. As always, making healthy simple.